There we go. Hello, everyone. Welcome. Thank you so much for joining us this morning. I'm Nancy Maldonado, and I'm the President and CEO of Chicano Federation of San Diego County. And today I have the pleasure of moderating a very important conversation. And I have two panelists here who I'm so pleased to have this conversation with. First, I'd love to introduce you to Roberto Alcantar. So I have the pleasure of working with Roberto here at the Chicano Federation. He joined our team in 2019 as the Senior Director and is now the Chief Strategy Officer. So we work very closely in his role, which is to develop, communicate, and execute strategic initiatives for Chicano Federation. And Roberto was raised in San Isidro, and so he's a native San Diegan, and as we all know, and those of you who know him, he continues to be a very active member of the community. He also graduated from UC Berkeley with a political science and public policy degree, and he worked in the nonprofit sector as an advocate for communities and has extensive policy, legislative, government affairs, and organizational strategy experience. So welcome, Roberto.
Thank you.
And our other panelist is Cheryl Mcmahon. So Cheryl has a background in community health, and she actually started her career as a community outreach worker specializing in health education. So Cheryl's passionate and committed to serving the community. And over the past 8 years, she's developed and grown one of the strongest outreach teams of community health centers. And she's established and fostered countless partnerships, implemented numerous grant projects, and she continues to grow a highly valued volunteer and internship program. And Cheryl is also currently the chair of the Farm Worker Care Coalition, which is based in North County, San Diego. So welcome, Cheryl. Thank you both for being here for this important conversation about effective tools against COVID-19 in the Latino community. So let's jump right in. Obviously, everyone is here to learn about what's happening with COVID and Latinos in San Diego County. And as we all know, since COVID reached San Diego, it's been around about the same trend that we've seen across the county and across the country, in that Latinos continue to be disproportionately affected by this virus. Here in San Diego, current infection rates are 57.7% of the infection rates are Latinos, and 49.8% of deaths right now are Latinos. And when you keep this in mind, that we're only 34% of the population, this is alarming. And obviously, with the work that we all do, we are really focused on how did this happen and what can we do? So let's just jump right into the conversation. Roberto, a lot of the conversations around COVID-19 infection rates have centered on South County and South San Diego. Can you talk a little bit about the trends in Latino infection rates and deaths as it relates specifically to South County?
Yeah, so one of the things that we saw on the onset of this pandemic is the fact that the South County really just got hit in a disproportionate manner by this virus. And as a result, that led to the Latino community being the most heavily impacted community in San Diego County. And so, we were at a point where we were seeing about 63% of cases, positive COVID-19 cases in San Diego County being within the Latino community. And approximately half of those the deaths happening in this county were in the Latino community. And the trends are still there. For example, if you look at the top 5 zip codes in terms of infection rates per 100,000, the numbers are just completely disproportionate to the rest of the county. The top zip code being in San Isidro, 92173, is seeing a rate of 9,351.6 cases per 100,000. That's closely followed by 92154, which is South San Diego, 5,817 cases per 100,000. Places like Barrio Logan, 5,437. Chula Vista, over 4,800 cases per 100,000. And that's in sharp contrast to some zip codes here in this county that are seeing less than 1,000 cases per 100,000, or even some zip codes that don't even have enough numbers to report. So, that's just alarming for this county. And, this is why we're doing the work that we're doing. And we are seeing an impact. The latest numbers do show that the Latino infection rate is now at 57.7%. Obviously, that's not a good figure, but it is progress. And so, that gives us hope that if we continue doing this work, those numbers will continue to go down. But as you can see, the rates are truly alarming for South County.
And, you touch on a good point. We have seen that percentage come down. So just want to kind of touch back on at its peak. I think the Latino infection rate was at around 63%.
Yeah.
Of infection rates. So, while we are seeing that come down, to your point, we still have to stay vigilant, and there's a lot of work to do. But I think that it's important to also note that, that percentage rate has come down a little bit. So thank you for that, Roberto. Cheryl, with the work that you do in North County, can you talk a little bit about any trends that you're seeing in North San Diego?
Sure. So the information I'm going to provide, somewhat similar to what Roberto has provided, is through the County of San Diego's website around COVID-19. And so while the North Coastal and North Inland regions do have a less cases, it's still showing rates in reference to the Latino cases being one of the highest. So when we look at the North Coastal region, Latinos are the second highest race and ethnicity in terms of case rate at, as of last week, would have been 2,483. And then in the North Inland region, Latinos are the highest with case rates at 2,852. So we're continuing to see a rise in Latino cases across the county, and regardless of the region, we're seeing similar trends.
And obviously, one of the questions that we get asked often is why, and we'll get into that why a little bit later, into why we think we're seeing these infection rates. But first, I want to touch on a little bit about, when we talk about the Latino community, this has been a topic across the country, really, about kind of lumping Latinos into one category. So I want to ask you, Roberto, is there a difference, or should we be paying attention to the Latino community versus the Spanish-speaking Latino community? Talk to me a little bit about that.
Yeah, you're right. I mean, the Latino community is a very diverse community, and it's very important for us to really differentiate that, reaching the Latino community is, different than reaching the Spanish-speaking community. So you have to have two different types of strategies in terms of how do you reach to these folks. And so, for example, with the Latino community, right, you want to make sure that the information is culturally relevant and appealing. It's something that our folks, can relate to better connect to that information. Whereas with the Spanish-speaking community, it's really about access and the most basic point of access to the information, and making sure that that information, when it's being translated, is translated in a local Spanish, right? A Spanish that folks talk locally, that they understand locally. A lot of times we see that stuff is translated, through Google Translate or the very, formal Spanish that a lot of folks can get turned off by. So it's just really important that when we talk about this work, it's differentiating that we have, the Latino community as a whole, and then you have the subset of Spanish speakers that, really are the ones who don't have a lot of access to information, and sometimes get completely forgotten about when doing this work.
Yeah, thank you for that. And Cheryl, I'd love to just ask you, a lot of the times when we're talking about San Diego, there tends to be kind of the Latino population in North San Diego sometimes tends to be overlooked. So tell me a little bit about why it's so important to kind of acknowledge this difference between Latinos and Spanish-speaking Latinos, and anything that you would share that maybe is different about North San Diego County.
I think, in my opinion, really echoing what Roberto was mentioning, that the importance in acknowledging the difference really plays a significant role in how our communities receive information. And I know we're going to get into it a little bit later in discussing barriers, but as Roberto mentioned, that if we're disseminating information in just English or in a in Spanish that's maybe not culturally sensitive or not appropriate for the groups that we're looking to provide information to, then it's not going to be well received. And then that just continues to exacerbate the barriers that we're already facing, where people are receiving information later than they should, which then it can be an attribute to why the case rates are so high, because we're not getting the information that we need to be able to disseminate it properly.
Perfect. Thank you so much. So let's transition then into response. And so, Roberto, we'll start with you. Can you explain kind of what the Chicano Federation's response was early on, and how then, and where the San Diego Latino Health Coalition, how that came to be?
Sure. So as soon as this pandemic hit, Chicano Federation hit the ground running in response to this pandemic, whether it was providing access to food, access to resources that families needed, information, we just kind of hit the ground running right away because we saw how this would have a disproportionate impact on our communities who were already struggling, who were already having a tough time in this economic climate. And so as we started looking at the information and talking to folks, we realized that a lot of the people that we were talking to and people that we served didn't have the information that they needed regarding COVID. They didn't really understand the severity of the issue. There was a huge disconnect between the information that was being put out there and the information that our community was actually intaking. And as Cheryl mentioned, part of that is, the avenues that our community gets its information from and where they look to. Our communities tend to be nervous about interacting with government due to, historic bad practices from, our governments that have, led to our communities not having that trust there. And so it's really ensuring that we can get that information to them without, them being worried about it or scared where that information is coming from. And so that's kind of how we started thinking about how do we move forward, is really being that hub of information, of resources to folks. But then we decided that it was time to really start advocating for our community when we started seeing the numbers. And we started seeing the fact that our community was getting hit pretty heavily by this virus. And so we started, talking to the county and really asking the county the tough questions about how are we going to work on this? How are we going to resolve this issue? Because right now we can't just look at this strategy overall as a broad stroke strategy to really focus on everyone as a whole. We had to focus on the Latino community when we're seeing, the disproportionate impact. And so, we reached out to supervisors, we advocated at the board meetings, and really organized our community around this. And luckily, we did have a receptive county that was willing to listen to us, adapt the way it was doing the work. And so they decided to launch, these efforts by contracting CBOs to do this work out in the community and be the people that are bringing that information, since, a lot of these community-based organizations have been working in the community for decades. They're trusted messengers. Folks interact with organizations like ours every day. So when we provide the information, they trust us, they listen to us. They're more receptive to our messaging. Plus, we are able to, really develop the messaging in a way that is reflective of our community, that is culturally sensitive, and in a way that's easy to understand. And so, we knew that we couldn't do this work alone. So we brought together a team of 10 community-based organizations to really do this work. And we're very strategic about who we brought onto this coalition, because we wanted to make sure that we were reaching pretty much as many different areas as possible, but also thinking about doing a whole wraparound service. It wasn't just about getting the information about COVID to the community. It wasn't just about making sure they're getting tested. It was about how do we also help alleviate some of the economic pressures and needs that these families have, while they're going through this process. Because if families were already struggling before this pandemic, you can only imagine what some of them are going through now. And so the idea was that we bring on these organizations and create a network of support services to build a stronger and better safety net for our community amongst us as CBOs, and really partnering. And this was a pretty innovative thing that wasn't really being done before. And so we're still learning as we go. But it's definitely work that needed to be done, and it needed to be done in this approach. And so what we've started to do is really come together as the San Diego Latino Health Coalition, which is a partnership of multiple CBOs, to really get the information out to the community. We're doing radio ads, we're doing TV ads, we're doing digital marketing, but we're also doing, face-to-face contact with promotoras, really going out into the community and making sure that we're talking to folks, that we're providing them with the information that they need, but the wraparound services too. So, we've also developed these resource centers where families can call in and basically, ask for whatever they may need at that moment, whether it's a COVID-19 safety kit that includes, disposable face masks, reusable face masks, thermometers, and information, to also, looking for affordable housing for them, making sure they have access to healthcare, making sure that they have, if they need help paying rent, finding ways to help fund that, and so really anything that they may need, because one of the things that, that we've seen out of this is the fact that we didn't have a strong safety net here in San Diego County. And, people were already struggling with housing. People were already struggling with their incomes. And, this pandemic has only made things worse. And so, we'll touch a little bit more later into some of the reasons why and how, this safety net has put us where we're at. But really just, it's been about really coming together, building a network of support for our community, and getting the information to people in their hands in a way that's easy to understand, in a way that's culturally relevant, and really just being flexible about our messaging and ensuring that we can provide the information and differentiating between our Latino community, the Spanish-speaking community, and even doing different types of, webinars where we're inviting experts to talk about, mental health within the Latino community, and how that's, being impacted by COVID-19. Having family members who've either lost loved ones or who have been infected themselves, to provide that firsthand experience so that folks know what's going to happen, like how to really deal with this issue and not be worried about treatment or actually getting tested. So, it's been a lot of work, and it's been, something that it's very new, but I think it's set a new standard and really showing the model that if we need to be effective in doing outreach, CBOs are basically the ones that are best positioned for that when working with these communities, because we are the trusted messengers. We've been doing the work on the ground for decades, and families trust us. So that's how it all came together. It really was, a community-led effort of advocacy and really, helping the county really see where the Latino community was being impacted and how. And we're very lucky that we do have a county that was very receptive and really, provided the resources for us to be able to do this work in helping our community.
Yeah, well, thank you. And what it sounds like also is, and I think what we've used the term in the coalition, in the San Diego Latino Health Coalition, is that we're building the plane after we took off. And I think it speaks a lot to the flexibility and the nimbleness of community-based organizations because of the work that we do. And I just really want to take a moment to applaud all of the partners in the San Diego Latino Health Coalition and just really recognize their work because, to your point, we have had to adapt quickly and we have had to move, and we just have some incredible community-based organizations that are so invested in the community and have just really done a remarkable job. So thank you, Roberto. Cheryl, I'd love to transition over to you and talk about the incredible work that you're doing in North County. Can you tell us more about that?
Sure. I would like to touch on what TrueCare has been doing since the pandemic has started. And being a community health center in this environment has been very interesting. It's been challenging. And you also have to continue to think on your feet. And it's been extremely stimulating, but it's also taxing. I mean, some of the things that Roberto talked about, it's easy to say, but definitely difficult to do. And it's a large undertaking. And as a community health center, seeing patients for preventative care or for chronic care conditions, we also have to think about how do we continue to keep them safe, but still trying to see them. And so we've transitioned the majority of our services as much as we possibly could into telehealth services. So we're providing medical visits through telehealth, behavioral health through telehealth, trying to do as much as we possibly can to reduce the number of patients that are in our health centers. So how do we balance trying to keep people out of the health center, but yet keep them safe, but then still address their needs medically and continue to get them in some way, shape, or form. And so we had to really readjust what our focus was for the organization. And we created a task force internally to be able to address this. As we have 12 health centers, 11 being in the North County, San Diego area, is a huge undertaking. We have a medical, dental, behavioral health, specialty, lab, and all of that can't stop. We have to keep going. And so we've done a lot to be able to transition to work in a virtual manner, just like many other people. It's obviously not the same as in person, but it's better than nothing. And our team has been doing an amazing job, obviously, continuing to serve our patients at the level that they need. The other thing that I would like to recognize is that 3 of our sites are COVID-19 testing sites. And so with providing medical care, there are risk factors and dangers with that within this pandemic. So how do we continue to keep our staff safe? How do we ensure that we have enough PPE, being able to sanitize our areas along with all of that? And so it's been very, very important that we continue to address all of this. So a couple of things that we've been doing is advocating to the state and our governors and all of our representatives and how important it is to continue to fund community health centers and help us serve the community. If we think about it, how do we keep people, safe and healthy? And it's through, as Roberto said, community-based organizations, but also community health centers. And also, the community looks to us as a organization that's going to provide information that is true, that is accurate, that makes sense. And so we need to make sure that we're continuing to push that forward. So on the health center side of things, it's definitely changed. For me, with community engagement, this was actually, I received a promotion to the director position in January. So for me, this is all I've been doing this year. And I can tell you, like many of us, this is not how I thought this year was going to be. But it has really pushed myself and my team to really think outside the box of how can we still continue to serve our community? And while a portion of it is still virtual, we also have been able to do many things in person. And so we've been doing a lot of virtual presentations. We still are running our food distributions in San Marcos and Oceanside, and our food distributions have actually significantly increased in terms of attendance. And I was actually out there because we were receiving so many families that were looking for help and assistance. And some of the things that you would hear people say would honestly break your heart. And it really puts into perspective how much people are in need, that they just would like a little bit of help in something, so that way it'll alleviate in other areas. We also continue to provide education during our community meetings. And also we collaborated with Feeding San Diego for a summer lunch program and have been continuing to do COVID-19 outreach there. We also took to the streets since all of our community events, the majority of them have been canceled. So what we decided to do was go back to our roots and really hit the ground and go door to door, do street outreach, stop by businesses and provide them information, for example, such as restaurants or markets, to see if they would put COVID-19 information into the bags when people were receiving them. So trying to be as innovative as we possibly can given what's going on. Also continuing to educate our patients, continuing to educate our staff as we're seeing a large rise in COVID cases, especially after the holidays. The other thing that we've been working on is social media. As you may know, we cover a large area. We have a health center in Ramona all the way over to Encinitas and Carlsbad. And so we're trying to cover a lot of ground with a small community engagement team. So we're doing our best to do as much as possible. And I definitely think that we've made a very large impact in terms of the information that we're providing. But it's never one organization that can do it. As Roberto mentioned, it really takes, I like to use the term, it really takes a village. It really takes a family to be able to push forward our efforts and our initiatives to make sure the word gets out and people are being educated appropriately, receiving access and services appropriately as well.
Yeah, absolutely agree. Thank you. And Cheryl, you touched on a good point about the reaching out to the state and the governor's office. So I want to take a moment to brag about Roberto's work and his initiative to reach out and talk about equity and some of the things that we've seen as a result of that. Roberto, do you want to touch on kind of any of your outreach to the governor's office and the incredible response that we've received from the governor's office as well?
Definitely, yeah. So one of the things that we really prioritized from the very beginning from this pandemic was thinking ahead, because we knew that at some point we had to start thinking about what will the recovery look like, especially for our communities. And so, we started this whole idea about, really making equity being at the forefront of recovery. And so, actually the San Diego Latino Health Coalition was kind of a branch off of a coalition that we initiated from the very beginning of this pandemic, which was the San Diego Roadmap to Recovery, focused on pushing for equity measures locally and at the statewide level. And so locally here at the County of San Diego, we push for more funding for rent relief. We push for funding on, for helping childcare providers, who are at the front lines right now, providing this essential service. Rent moratoria, eviction moratoriums, all these different policies. And, we decided that it would be great for us to really start talking to the governor's office about equity and thinking about how do we really make sure that, as counties start to reopen, as counties really start to, initiate their economies again, that the equity factor and the fact that some of these communities have been heavily impacted isn't forgotten. We'll go back to, back in May when there were the board of supervisors were asking to move into, the tier 2.5, almost tier 3. We raised the alarm bells and said, wait a minute, we need to slow down. We need to really think about, our communities and addressing these issues. And, it didn't happen. And so now we're here. And where we have seen, this reversal of these reopenings, and this not only affects, the communities themselves, but it also affects the small businesses that were already struggling, right? So we have to be strategic about how do we do this. And that was our messaging to the governor's office was, we need equity. We need to make sure that equity is a real thing, and we need to find a way to measure it. And so they were very receptive to the idea, which then, they unveiled their equity plan, and really looking at how counties get rated in terms of, numbers and cases, and really incorporating an equity factor into that. So we're very proud to have, been able to move forward with the governor's office and moving these measures forward. But, again, it's the fact that the burden falls on us, right, as CBOs to really think about these things, and whereas these things should be at the forefront of our policymakers and decision makers, and that's part of the role that we currently play, it is a burden for these organizations to have to constantly be that voice of reason sometimes, or the voice of equity, but we hope that based on what we see now and really people understanding how this unequal system for our communities has put us where we're at, and this has affected all of us, right? Because what's happening in South County, is affecting what's happening in North County and in other parts of San Diego County, where because of the way that things are, we just can't reopen anywhere. Folks not wearing their mask, in certain communities will have an impact on other communities. We see that a lot with some of the more affluent communities where folks are, we're fine, we don't really have that many cases, but the workforce that's there, the service industries is there. Those are the folks that are getting on the bus, riding public transportation, going back to some of these zip codes in South County, and then therefore bringing that burden back to the community and affecting, their own community. So we have to be mindful that while our area around us might be okay, and where you're at might be great, and you might not be seeing the impact, just be mindful that your actions are impacting South County and some of the more vulnerable communities in San Diego County. And so that's something that is really important for us. And so we'll continue to bring equity into the forefront. And we hope that, as we look at recovery, equity will be at the forefront of policy decisions, so that we can make sure that when we do have another situation like this, because, pandemics do occur, and come back, we're ready for it. And we don't see, the fact that, your zip code really defines your odds of living or dying from a virus, and the impact it'll have on you. So we hope that that we'll continue to focus on the equity factor.
Thank you. We did have a quick question. Somebody asked what CBO stands for. So yes, thank you for that. It's community-based organization. Thank you for that question and for allowing us to clarify. So Roberto, you touched a little bit on the reasons why we're seeing such a high rate of infection and death in the Latino community here in San Diego County. You mentioned public transportation. You mentioned, that there is a overrepresentation of Latinos in frontline as frontline workers in those essential jobs. Are there any other reasons that you can point to that why is this rate so high among Latinos?
Yeah, well, those factors are factors that, have been identified, not just by us through our own research, because, that's one of the things too that I think is important to note is that, there wasn't a lot of research being out there. Actually, there was no research being done on why the Latino community wasn't, getting tested, or why the Latino community was so heavily impacted, what the needs were in this heavily impacted community. So we took that upon ourselves, that we were going to do the research. We partnered with UCSD, to do research in the community and ask these questions, to really find out what the needs were, but also, the whys behind some of these numbers. And, and Sandag also, had some of the same findings, which is, that the fact that Latinos are overrepresented in these, essential but low wage jobs, right? That are high exposure. So we're talking grocery stores, we're talking, customer service jobs, in the service industry, where they are in high risk. It's also the high percentage of folks that use public transportation, but also we have to look at, I want to touch back again on this idea of the safety net, right? And the really just the economics of San Diego County. We know that living here is very unaffordable for a lot of folks. And so what we see a lot in our community is that families have to share one roof, with multiple other households, right? So you have, multi-generational families, living together under one roof. You have multiple families sharing one home. And so, a lot of these folks don't have the option to isolate themselves or, to really have that space for themselves. And so you have, multiple families with multiple members of those families working in these high risk, high contact jobs, all going to different work sites, interacting with different people, and then coming back home to share one household. And that creates a problem in itself because it's that lack of access to affordable housing. It's also the lack of access to healthcare. If you look at access to hospitals and clinics availability in some of these high, impacted communities, it's very minimal, and folks just don't have access to these, to the healthcare system to be able to, get constant checkups and be able to make sure that they're okay. We also know that economic opportunity, the fact that the Latino community is usually more overly represented in these type of jobs, shows that there is a lack of economic opportunity and mobility here for our residents. And also, the education factor, the fact that, a lot of folks don't have access to education. So, they either don't have, access to learning English, in a way that's free and accessible, or just, really being able to have the understanding of the information that's out there. So all these factors really come into play, and these are underlying factors that, have been plaguing our communities for decades. The lack of access to housing, the lack of access to economic opportunity, and even just the lack of access to building that generational wealth that gives you that cushion, right? That ability to say, what, we have the option of working from home, but our community really doesn't have that option. A lot of folks in our community are not homeowners where they can say, hey, we have equity in our home that we can tap into, we have an economic crisis. A lot of our families are 1 or 2 paychecks away from homelessness and poverty. And so, there's all these things that we need to address as part of our COVID response. It's not just, again, about finding vaccine, making sure people are treated and have the information. It really is about making sure that we address all these issues so that folks have access to housing, have access to economic opportunity, so that when a crisis like this hits, it doesn't impact them disproportionately. So really, it's really these factors coming together. And then, again, it's about the fact that the information at the very beginning, the lack of access to information and the way it was delivered to folks just wasn't reaching them. And so, that's where we stepped in and we're able to kind of become that vehicle to get that information out there. But yeah, these factors are what is putting our community at greater risk.
Yeah, no, thank you for that. And a lot of these, you're right, it's one thing to get the information out, but when there's systemic factors that play that can't be turned around overnight, that one of the questions we get is why the rate continues to be high. And you touched on a lot of those reasons that can't be rectified very easily. It's because, like you said, they've been plaguing our community for years. Cheryl, when it comes to testing and treatment for COVID-19, are there talk about the barriers for the Latino community and what you're seeing?
Sure. A couple of the points I'm going to make are Roberto had already emphasized, which is great because we're seeing the same things. People are noticing these trends and what's happening within our communities. And so with the COVID-19 pandemic, we have to recognize that it's exacerbated already existing economic and healthcare inequalities within racial groups, like what we had talked about, specifically the Latino community. And so Roberto had definitely touched on that and just continuing to emphasize that this gap is getting larger and larger. And how do we address this? How do we deal with this? How do we support our community? So especially at the beginning in terms of testing barriers, we have to recognize that the accessibility to tests. And even as a community health center, we had a limited amount of tests that we could provide. And so how do you decide who receives one and who doesn't? So you have to provide guidelines. And so it took several months for not only the county to receive more tests, but then also receiving the results back in a timely manner. Because I know that there are some individuals who it took almost a month to receive their test results. And that, unfortunately, is not going to provide appropriate guidelines for individuals when they have to wait for these test results and quarantine during this time. So we have to obviously access to the test and then the availability of the test. The other thing, especially within the healthcare world, what we experienced was around PPE and safety, as I mentioned. How do we ensure that we're taking safety within our staff who are administering the test and our providers, and ensuring that we're preserving our workforce so that way we can continue to serve the community and serve our patients. As more testing sites have continued to pop up, we're still running into issues in terms of Latinos' proximity to those locations and just a lack of transportation, or even the timing of some of these testing sites are in the middle of the day, which if we go back to talking about working individuals, it's not feasible for them to leave and work in the middle of the day to go get tested. So how, again, do we create access to testing? And so I do have to recognize that the testing locations have grown significantly, and there's a lot of pop-up sites. But then to add to some of the confusion is that some sites are there and then they're not. The time frames changes, the location changes, and so that continues to cause confusion. So how do we stabilize certain locations so that way people know this is the date, this is the time, and this information is not going to change on a daily or weekly basis, because it just continues to cause confusion. The other barrier that we have to recognize, and Roberto touched on it, is the lack of representation when creating informational tools. And what I mean by that is that the majority of information when it was first put out was only in English. And what then happens is then it pushes back everyone else's ability to be able to retain that information and have that information. So just to give an example, let's say that we have 3 individuals. 2 individuals are English speaking and 1 individual is Spanish speaking, and we provide them the information, right? The individuals who are English speaking have an advantage in terms of how they protect themselves, what measures they take. And the other thing is they can provide that information to maybe family and friends to continue to educate them. But then what happens is the individual who is Spanish speaking doesn't receive that information the same way and may not take the measures that they need because there isn't the level of understanding there. And it's by no means their fault. It's really how the information is getting to them, and we're doing a disservice to them and how we're disseminating the information. So I think adding to what Roberto talked about is that gap is continuing to widen because at the beginning there was already a disadvantage. in terms of how the information was put out and how the information was being received. And it just continues to cause disparities in health literacy. We can't expect people to just know this information, especially when it's so complex. Some of the information that's been put out there about COVID-19 is such at a high level. Even individuals like ourselves are confused about it. Where can we find the information where it's easy to understand and that it really helps them relate to what's going on, so that way they're able to make the best decisions for themselves health-wise? And unfortunately, that didn't happen the way that it needed to. So then what in turn caused misinformation. So then misinformation, rumors, myths start to get put out into the community, and then also watching the media. Media obviously blows up anything and brings up all kinds of like rumors and information. So we have to recognize that not everybody knows how to find that type of information. And that's, information that is true, that is accurate, and that is credible. Because many of us watch the news and we're on social media, and you'll see a post and you end up taking that post and you're like, oh, these are facts. And then you run with it. We're all guilty of it, but it just continues to really push the narrative in a way that we don't want it to go. And it just continues to exacerbate these barriers of information. The other piece that I wanted to mention around testing is fear and negative stigma. There are many people who are concerned about getting tested because they don't want to have that label on them. They don't want that negative stamp. And so people are putting themselves in a situation where they would rather not know than know and be basically a target. And so we have to recognize people's fears and really recognize where they're coming from and why they feel that way. In terms of treatment, I wanted to reference treatment and quarantining together, as Roberto had put, and that a lack of access to health insurance or healthcare accessibility, the hospital system, and especially in the beginning being overloaded and turning away patients, but then also going back to the inability to isolate and quarantine. And so that continues to be a very large issue, in that individuals are hesitant to be tested. They're hesitant to have to quarantine because they are the primary source of their household's income. And if they test positive and they have to isolate, they have to stay home. And then what happens is that it leads to this extreme financial hardship. And we're talking about, as Roberto had mentioned, Latinos in roles and positions that they don't have sick leave, they don't have paid time off. So how do we continue to support, how do we support them, right? They're working in industries that they pose a higher risk of exposure. But if you tell someone, hey, you have to quarantine for 2 weeks, the first thing that they're going to think of is, how am I going to pay my bills? How am I going to take care of my family? And I think that is a huge hurdle that we have to go through. As Roberto mentioned, it's extremely expensive to live in San Diego County in general. And we're already continuing to see this immense financial burden start to build up on everyone, especially our Latino community.
Yeah, absolutely. Thank you for touching on all those great points, Cheryl. And so, we're reaching near the end of our time, and so I want to make sure that people who have tuned in get a sense of what has worked, right? We've talked a lot about what hasn't worked and some of the barriers. In the work that you've done, just, Roberto, what outreach strategies have worked, or what lessons have you learned? How can we do a better job of reaching our Latino community here in San Diego County?
One of the things that's been really good for us has been just being flexible with our strategies, and the willingness and ability to quickly adapt to make changes, right? So one thing that we've been doing with our outreach is we're constantly checking in with the promotoras who are on the ground, talking to people, and just making sure that the information that is out there is actually information that is working, that is interesting. We've held info sessions with just the promotoras to really help us shape the messaging and how to better reach out to the community. We've also, looked at, doing these community information sessions, both in English and Spanish, and really, talking about issues that our community wants to hear about, but that's research backed. And so, I think one of the key takeaways I'd like to share with folks is that it's about the research. It's about really educating yourselves on what the community needs, What are the things that are worrying the community so that you can then design the outreach based on that. And so the way we do that is, we do distributions where we give out these COVID-19 safety kits to the community. And for example, last week, right before Thanksgiving, we gave out as a coalition over 800 kits in 1 hour. We've done kit distributions in Barrio Logan, where, we gave out 400 kits within the first 15 minutes. So there's a huge demand for these supplies. So because of that, we've been really active in making sure that we can get as many kits of these kits out there, working with local media, Spanish media in particular, about, really having, these conversations about what our community can do to keep themselves safe, really, and really tailoring the message to that. But when we do provide these kits, we do gather information from folks, and we follow up with a phone call, and we provide, information on testing. We provide information on, hey, did you know that if you do test positive, there is a voucher program, that the county has to help you isolate if you need to. There is an economic, income replacement stipend that the county also has available for folks who don't have access to those traditional benefits. And we're talking too about our undocumented folks, who don't have a lot of these government benefits, who now can use these programs that the county has put forward, as a result of advocacy from, our organizations and the folks on the ground who really have driven a lot of this work. So it's been about really connecting to folks on a personal level, and really using that network of community-based organizations, the CBOs, to talk to folks, to really incorporate the messaging into the everyday work that we're doing, right? So for example, we have folks that work with families here who have, children in our childcare system, and they're interacting with them daily, right? So it's about having our staff trained so that when they are talking to those families, they talk about COVID-19 also. They check in, hey, have you had anyone in your family who's tested positive or not feeling well? Do you need to know where the next testing site is at? And so really it's just incorporating it into the everyday work, but also, the intentionality behind our messaging and targeting. And so that's what's really been working for us, is just having that really personal connection to our families, to the people that we serve, and then just being that trusted messenger, and having that network of trusted messengers has been very effective for us.
Thank you, Roberto. We did have a question. Somebody wanted to know about the kits and what the COVID-19 safety kits include.
Yes, so our COVID-19 safety kits include disposable face masks for adults and children. We do have reusable face masks in there, hand sanitizer, sanitation wipes. We also have a digital thermometer in there, along with different resources for, families to really know what's out there for you. So resources in case someone tests positive or you test positive, access to different, things that you may need during this time. It's all in there. And then we also, include all sorts of other different resources as they come along. We get all sorts of donations. So sometimes we're able to include, additional items in these kits. But the idea behind these kits is to be able to provide these resources to our community, particularly a lot of these essential workers who, tell us that their employers aren't providing enough personal protective equipment. They don't really know, they don't have access to a thermometer. They're pretty expensive. These are about $50 a piece, and not only are they expensive, but they're also hard to come by. So what we've done is we've leveraged our access to the supply chain and be able to buy these things in bulk so that we can get them at a lower cost and then get these into the hands of the community right away. And, these are anyone can ask for a COVID kit. We're here to provide this information to anyone that needs it. So please, we'll put the link to the website for the Health Coalition on the chat right now, and that way, you all can access that. But so that way, you can request a kit to there or see what numbers to call for any additional resources.
Or if there's any organizations that would love to jump in on those orders and would like to provide kits, we're happy to include that in our orders. Like Roberto said, we do get them at a much cheaper rate when we order in bulk. So if there's any community-based organizations that would like to talk about that, happy to do that. And I will add that this next round of kits will also contain the oxygen readers, because we've been hearing that there is a need for that. So thank you, Roberto, and I will brag about the coalition for a minute that we're reaching, having been able to get out almost 10,000 hits to the community, and again, still such a need. Roberto, you also mentioned the promotoras, so I want to recognize and appreciate the promotora network throughout the entire county, because they have been the ones on the ground disseminating information and are such a valuable resource to this entire county. So definitely want to recognize and appreciate our promotora network. They are invaluable. So Cheryl, transitioning over to you, what has worked? What strategies have worked? What lessons have you learned? And how can we better reach our Latino community?
Sure. Just to touch again on the promotora model, it is a try and true method, and we know that it works. It really is. This is my neighbor, and I trust my neighbor, and my neighbor is going to provide me true and accurate information. And so, as you mentioned, they are invaluable, and they are just a huge. They're just huge advocates of their community, and that they're able to help continue to push the messages that we're looking to reach out. The other thing that we've been working on as an organization is focusing on our farm worker population in North County. So as we know, farm workers are a higher risk to respiratory conditions, which is specifically what COVID is. And so we want to ensure that we're providing PPE, providing information, doing in-person, one-on-one, obviously in safe environments, to ensure that our true care, our commitment is to serve our farm worker population. The farm worker population is what our organization was built on in our foundation. And so we have done that over time through established trust. And it's taken a long time. The other thing is connecting with employers to be able to connect with the employees and allowing them to understand the importance of their employees' health and how that's going to continue to support them to live healthy, thriving lives. And so we want to ensure that they're receiving gloves, PPE, as you all mentioned, in terms of like kits and face masks and hand sanitizers, but then also the information. And then the information is being, again, provided to them verbally or with information that's easy to understand. The other thing that we have been working on is collaboration with community partners to bring additional resources to our community. I think there's something to be said about collaboration and how not one organization can do it all. And we really lean on each other for partnership, for collaboration, for support. And so with the Farm Worker Care Coalition, we had established a finance relief program with the support of the Chicano Federation, as well as other funders. So I do have to provide Nancy and Roberto a shout out, and we had received $20,000 due to the fundraising that they had provided to us, which will go to support our farm worker populations in North County. And so we recognize that it's not just one. It really takes all of us together to continue to be successful and ensure the health of our communities.
Thank you. We have two really quick questions that I want to make sure we address before we start to wrap up. Cheryl, if you feel comfortable answering this, do you know of any research, or has there been any research around vitamin D deficiency in the Latino community?
I don't, unfortunately, but I would be more than happy to take that information back and ask our clinical team, and then I can route back. What I'll do is I'll type in my email address for the individual who had posted this question and be happy to route back.
A great question. And then there's another question about, is there a large number of community members who see the pandemic as a hoax in the Latino community? And so, I'll go ahead and answer that. I don't think that we're seeing a large number who think it's a hoax. I think we're seeing a large number who are getting misinformation. And I think, a lot of it, we touched on social media, a lot of things that get shared. So we're seeing a large, it's reaching people that maybe don't have access to or don't know where to go to get reliable information. So it's more of the misinformation than people believing it's a hoax from the work that we're doing. One more question, is there a Facebook, Twitter page in Spanish that shares information for the Latino community in San Diego? Roberto, you want to answer this one?
Yes, so there is a Facebook page for the San Diego Latino Health Coalition. I just put it in the chat for everyone to see. So go ahead and click there, and then you'll see the links to the other social media pages on there.
Wonderful. Let me make sure I got all of the questions. Really quickly, touching on vaccines, and the question was, has there been any outreach done for Latino participation in the COVID vaccine trials? So really quickly, if either of you want to address vaccines, and then we'll wrap up.
I do not have an answer specific to that question. For TrueCare, as of right now, we are not doing any outreach in regards to the vaccine at this time. One of the things that we're currently doing, or our Chief Medical Officer and our leadership, is that we are connecting very closely with the County of San Diego and Health Center partners down in San Diego. There's a lot of things that we don't know, and we're still receiving a lot of different pieces of information. And so as we receive that information and it's concrete and it's solid, then we will work to put out information appropriately. Again, going back into, we want to mitigate the misinformation because especially with the vaccine information going out right now on media, social media, it's everywhere. And so I would just recognize to be mindful about the information that you're sharing or the information that you're receiving, and ensure that you're receiving it from credible sources.
Yeah, and Cheryl makes a good point, right? It's about gathering that information, and really just making sure that our community is well informed. That is our goal, making sure that they have all the information that they need so that they can make the best decision for themselves based on facts and data that's out there. So, we've been vigilant too, making sure that, as these trials are out there, that they're not taking advantage of our communities by leading with monetary incentives and such. We want to make sure that, things are being done well and that our community is respected, because we have to think back into history that, we do have a dark history where communities of color have been misused and mistreated in medical trials. And so, that's something that we can't forget about. So we just want to make sure that we work with our community and those partners to ensure that people have the information that they need.
Yes, absolutely. Thank you, Roberto. A question about how we considered working through independent grocer associations. Yes, we have, and we're rolling out a new outreach plan for December that includes grocery stores and getting information out. So thank you for that question. Another question about school districts getting kits for homeless families, and where can parents get the kits? So there is a high demand for kits. Absolutely, you can contact Chicano Federation or any of the other resource centers that are part of the San Diego Latino Health Coalition and reach out for kits. They are available to anyone. So please, if you're interested in getting a kit, go to the San Diego Latino Health Coalition, look at who are the resource centers, and those are the community-based organizations that have the kits. Obviously, Chicano Federation being one of them. So as we're nearing the end of our time, I want to just wrap up with some final thoughts. Roberto, with all of this work, everything that we're seeing, what's next? Where do we go from here?
It's really ensuring that we continue to reach out to the community, but using this information, everything that we're learning, to develop policy recommendations. That is our next step, is really making sure that we have policy recommendations based on feedback, experience, and the work and the issues that we're seeing on the ground. Because again, we cannot go back to normal. Our communities deserve better. We need to fix the system that has put us here in the first place. This is the result of systematic failures and intentional historical underfunding that we need to correct. And I have full faith in our newly elected leaders throughout San Diego County that we will come together and address these issues through real policy work that's going to address our safety net and deficiencies that we've seen.
Wonderful. Roberto, Cheryl, thank you so much for answering all of our questions and for this insightful conversation and all of the work that you and your organizations do. Thank you so much to everybody who tuned in and who was with us this morning. If you have any additional questions that we didn't get a chance to answer, please reach out. Chicano Federation, and I'm sure Cheryl would, I think both entered their contact information, so please look at in the messages and you can find both Roberto and Cheryl's contact information. Thank you again for joining us this morning. So thank you to all of our participants, and thank you again, Roberto and Cheryl, for everything.
Bye, everyone.
Thank you.
Thank
Bye.
you.